In this presentation, we will talk you through the dietary recommendations for after bariatric surgery. My name is Regan Crockett and I will be presenting with Alison Buckingham, and we are part of the weight management dietetic team.
The topics that we will be covering in this presentation include the rules for eating to support safe and effective surgery, the stages of recovery diet for the first 6 to 8 weeks following surgery, the recommended long-term eating plan to help you to maintain good results, and the vitamin and mineral supplements you will be required to take lifelong, and some tips for overcoming potential issues such as weight regain and food intolerances. The golden rules for eating after bariatric surgery. Establishing good eating habits before and after your surgery can help you to prepare for surgery and achieve good results. These habits form the golden rules for eating after surgery, and these rules are to eat 3 small meals a day. Regularly spaced meals can help you to control your hunger and portion size, and you are recommended to serve your meals on small side plate. Snacks in between meals should be limited, and be particularly careful of snacking on foods with limited nutritional value, such as crisps, cereal bars, biscuits, sweets or chocolate. If you do need to have a snack, this should be a planned snack and provide some nutrition. For example, fruit or vegetable sticks, fat-free yogurt or a boiled egg. How you eat is also important. You should be practicing eating slowly, chewing each small mouthful at least 20 times, putting your knife and fork down between mouthfuls, and pausing for 20 to 30 seconds. A meal should last around 20 minutes. You should choose nutritious foods. Your diet should consist of mainly lean protein, fruits and vegetables, and low-fat dairy. You can also include small amounts of starchy carbohydrate. Ideally, whole grains are those that are high in fibre, but be cautious of filling up on these foods. And bread should be limited or avoided. You should keep sugary or fatty foods to an occasional treat. Advise to avoid calories. You should make sure you drink at least 1.5 to 2 litres or 3 to 4 pints of fluid each day. Suitable choices would be water, no added sugar squash, herbal and fruit teas, and teas and coffee. Remember to separate your drinks from meals by about 20 to 30 minutes either side, and to not drink with food. Fluids like fruit juices and smoothies, and milky drinks like lattes, Ovaltine and hot chocolate, and sugary soft drinks and alcohol all contain calories and should be limited. We recommend that you do not drink any carbonated drinks, any fizzy drinks, any sparkling drinks. You're encouraged to get active by building activity into your routine as you are able. We should ideally be aiming for 30 minutes of moderate intensity activity every day. Increasing activity levels has been shown to help maintain weight loss. And finally, you should attend your appointments. By considering surgery, you are agreeing to attend follow-up appointments, and the number of follow-ups you will have will depend on the type of surgery and if you encounter any problems. Recovering from surgery. For the first 24 hours after surgery, you will be given water to sip, and if you're able to manage this, you will then move through the stages of recovery, depending on which type of procedure you have had. To allow your stomach time to heal after surgery, you will be asked to follow a modified textured diet, which follows 4 stages. The 4 stages are Stage 1, fluids only, Stage 2, pureed diet, Stage 3, a soft diet, and Stage 4, normal textured foods. If you opt for either a sleeve gastrectomy or gastric bypass, you will move through all 4 stages, spending 2 weeks at Stage 1, liquids, then 2 weeks at Stage 2, puree, and then 2 weeks at Stage 3, soft, before returning to normal textured foods from around week 7. If you opt to have a gastric band, you will not be required to follow Stage 1, but you will start on Stage 2, the pureed diet, and follow this for the first 4 weeks after surgery. You will then progress to a soft diet for the next 2 weeks, and again return to normal textured foods from around week 7. It's important not to rush through these stages, but it's equally important to not become stuck on the soft food stage. Bariatric surgery will work best when people are able to return to normal textured foods to help maximise satiety. Stage 1 is fluids. If you choose to have a sleeve gastrectomy or gastric bypass, you will be required to follow a fluid-only diet for the first 2 weeks. Suitable fluids would be no thicker than milk and would run easily off a spoon and leave no residue. You should aim to have a total fluid intake of at least 1.5 litres a day to prevent dehydration and constipation. During this stage, you're encouraged to only have small sips, as gulping can cause pain. Fizzy drinks, alcohol, sugary drinks, or drinks with lumps and bits in should not be consumed at all during this stage. Water, no added sugar squash, herbal and fruit teas, as well as some regular teas and coffees, can be taken to help support good hydration. Fruit juices and tomato juice, smoothies, and thin blended soups can be taken in small quantities and will help to provide you with some vitamins and minerals. Protein is very important to aid your recovery, and you should aim to have 2 servings of a high protein drink each day. You can make your own high protein drink at home, and this could include a fortified milk or a protein smoothie or a soup. The dietitians can provide you with recipes for these on request via email. You could also purchase commercial whey protein supplements, and a suitable choice would provide around 20 grams of protein per portion and would contain less than 5 grams of sugar per 100 grams. We can provide you with further information about suitable commercial protein drinks to have during this stage. Stage 2 is pureed foods. If you have chosen to have a band, you will need to follow a pureed diet for the first 4 weeks after your surgery. And if you have chosen to have a sleeve or a bypass, you would follow the pureed diet for weeks 3 and 4 following your surgery. A puree is thicker than a fluid, but would still have no lumps or bits. It may leave a residue on the back of the spoon, and it would be a similar consistency to a thick yogurt. During this stage, you should be working towards 3 meals each day. You should still continue to have 1 protein drink a day to supplement your diet. Portion sizes may vary from person to person from day to day, but they're usually between 3 to 6 tablespoons, which is around 1/2 to 1 full yogurt pot size. We recommend that you serve your meals in small pots or ramekins. Tips to help you prepare for the pureed stage would include making sure you have a food processor or a blender and a sieve to get a nice smooth pureed consistency. Keep foods separate to each other as you puree them to help preserve their colours and individual flavours. You may need to add extra liquid as you puree a food, and you could use milk or stock, gravy or sauce. Adding herbs and spices and seasoning will help to boost the flavours and make a tastier meal. It can be easier to chop up large items before putting them into the food processor for blending, and it can be helpful to prepare quite a few options in advance and then make individual portions, freezing them in small pots, ice cube trays or ramekins. It is important to think about your intake during this stage, particularly your protein, as your body will still be recovering. Protein foods that puree well include lean chicken, turkey or beef mince, cooked chicken breasts, scrambled eggs, cooked fish, and beans and lentils. To get good nutritional balance, you can add some vegetables. Root vegetables like carrot, parsnip and swede, as well as cooked vegetables, cauliflower, broccoli, peas, squash and pumpkin, all blend well, and these could be cooked by roasting or boiling. It's also easy to puree most fruits. Stewed, peeled apples, pears, plums and rhubarbs will puree well. You may want to add a small amount of powdered sweetener if needed. Tinned fruit and juice also purees, as well as naturally soft fruits, but berries may need to be sieved to remove any seeds or pips. Dairy foods will fit quite well into the pureed stage. For example, you could include a low-fat cream cheese, yogurts which are smooth, and cottage cheese which will need to be blended to make it a puree consistency. You may also want to include small amounts of carbohydrate. Suitable choices would be cereals that are made smooth when mixed with milk, for example, Ready Brek, or cereals which when soaked would be smooth, Weetabix or Oatabix. For main meals, you can add a small amount of a smooth carbohydrate such as mashed potato or sweet potato. If you want any recipes or further information on the puree diet, please speak with your dietitian. Stage 3 is the soft diet. Everyone who has had bariatric surgery, regardless of what procedure they have had, should be ready to move on to stage 3, the soft diet, by the end of week 5. Food suitable for this stage should consist of small pieces of naturally soft food that are very easy to chew and wouldn't necessarily need a knife to cut them. You should still aim to follow all of the eating rules and have 3 small meals each day. You can plan to have a healthy snack if needed, and you can still have a protein-rich drink each day if you feel you are not meeting the recommended protein intake. Although portion sizes may have increased slightly by this stage, you should still be serving meals in a small bowl or dish or using a ramekin to help manage portion size. Remember to aim to have at least 1.5 to 2 litres of fluid each day, and this should be drank between meals, leaving a gap of 20 to 30 minutes either side of a meal. Protein will continue to be important and should be included with at least 2 of your meals every day. Suitable food choices for protein would include lean minced beef, turkey or chicken, small pieces of slow-cooked or casseroled meat, white fish, tinned fish like tuna, scrambled or poached eggs, or beans and pulses. To work toward the recommended 5 portions of fruit and vegetables a day, you should aim to have some type of fruit and vegetable with every meal. You can include well-cooked vegetables, naturally soft fruits, peeled apples and pears, and tinned fruit in juice. Dairy foods are all suitable in the soft stage as well. Low-fat soft cheese, any type of fat-free yogurt, or low-fat milk. Dairy alternatives, which are also calcium fortified, can be chosen here if desired. You may wish to try small amounts of carbohydrate during this stage as well, and cereals which are well soaked in milk, porridge, or boiled or mashed potato, or well-cooked pasta and rice could also be tried. During the soft stage, there are some foods which you will need to avoid, such as fruit and vegetable skins, raw vegetables like salad, dried fruits, and tough foods like nuts and seeds or tough meat and large pieces of meat. You should be aiming to make healthy choices and should not choose to eat fatty meats, processed foods, or foods high in fat and sugar. This would include ice creams, puddings, chocolate, pastry, and creamy sauces. However, during this stage, you will be able to enjoy small portions of normal, healthy, balanced meals, like cottage pie, fish pie, bolognese sauce made with lean mince and vegetables, stews, chilies, and curries, remembering to maintain good nutritional balance at each meal.
Everyone who has had bariatric surgery should be aiming to start introduction of harder or unmodified textured foods around 6 weeks after surgery. The introduction of new foods will take time. At first, try very small amounts and remember to chew everything thoroughly. Over the next few weeks, try lots of different foods and increase the amounts as tolerated. You should still be aiming for small portions and serve your meals on a tea plate. Introduce crispy textured foods like crackers, crisp breads, breadsticks and Melba toasts, raw fruits and vegetables like salad, more fibrous foods like fruits and vegetable skins, and harder foods like nuts and seeds. Avoid foods high in fat and sugar and large amounts of carbohydrates and bread, as well as fizzy drinks and alcohol. Over the next few months, you should be aiming to establish a healthy, balanced diet. Your long-term eating plan should consist of small, regular meals. Be mindful of old habits returning. This includes meal skipping or regular, unplanned or unhealthy snacks, picking or binge eating. Fruits and vegetables. Aim to have 5 portions each day. That means having at least 1 portion with every meal. Protein-rich foods. Aim to have 2 or 3 portions each day. This means having some protein-rich food with at least 2 meals each day. Good choices include skinless chicken, fish, eggs, beans and pulses, tofu or other vegetarian alternatives. Dairy and alternatives. To meet your requirements for calcium, try to include 3 portions of dairy or alternatives each day. Good choices include skimmed milk or semi-skimmed milk, fat-free yogurts and small portions of cheese. Starchy carbohydrates. Choose whole grains wherever possible and keep portions small to avoid filling up. Healthy fats. This includes olive oil, vegetable oil and spreads made from these. Limit your intake to 2 to 3 small portions each day. This is the equivalent of 2 to 3 teaspoons of spread or oil. Healthy fats can also be found in foods like oily fish, nuts, seeds, avocados and olives. Fluids. You should aim to have about 2 litres or 4 pints of fluid each day. Choose water and no added sugar squashes, as well as herbal teas and decaf teas and coffee. Try to moderate your intake of caffeinated drinks to around 4 to 6 cups each day. Avoid fizzy drinks completely and avoid alcohol for at least 3 to 6 months following surgery. If you choose to drink alcohol after this, then limit your intake to 1 to 2 drinks at any one occasion and do not exceed 14 units per week. Foods high in fat, sugar or salt have limited health benefits and you should keep your intake to an occasional treat. Sugary or fatty foods may make you feel unwell or cause you to have symptoms of dumping syndrome. If eaten regularly, they may contribute to weight regain. You can use the food label to identify these foods. A food is high in fat if it contains more than 17.5 grams of fat per 100 grams. A food is high in sugar if it contains more than 22.5 grams of sugar per 100 grams. And a food is high in salt if it contains more than 1.5 grams of salt per 100 grams. Having bariatric surgery will mean that you need to take vitamin and mineral supplements for the rest of your life. Not supplementing your diet with vitamins and minerals may lead to a deficiency. Vitamin and mineral deficiencies can take time to show symptoms but could increase your risk of the following conditions: anemia, poor bone health and osteoporosis, ulcers, fatigue, poor immune system, poor wound healing, skin problems and hair loss, muscle weakness, vision disturbances, infertility, and neurological symptoms like pins and needles, confusion and numbness. The table shows that if you opt to have a gastric band, you'll be required to take 1 complete A to Z vitamin and mineral supplement each day. Your blood test will show if you need to take any other supplements. If you have a gastric bypass or a sleeve gastrectomy, you will need to take Forceval Complete Vitamin and Mineral Supplement once a day or an over-the-counter A to Z twice each day. You will also need to take a calcium and vitamin D supplement and an iron supplement daily. Lastly, you will need an injection of vitamin B12 every 3 months. For more information about vitamin and mineral supplements, please speak to your dietitian. Troubleshooting problems. Dumping syndrome is a condition that can affect people who opt to have a sleeve gastrectomy or a gastric bypass. Eating sugary or refined carbohydrate foods can lead to the stomach contents emptying into the intestines too quickly. This leads to symptoms such as nausea, fatigue, dizziness, bloating, or low blood glucose levels. This means sweating, shaking, dizziness, confusion, and hunger. Most people who have dumping syndrome will only have mild symptoms, which will improve gradually over 30 minutes. Dumping syndrome usually responds well to making changes to your diet. Make sure that you eat small amounts. You may have to reduce your meal size and eat 4 meals each day. Separating your drinks from your meals will delay stomach emptying, and chewing food well will prepare it for digestion. Avoid sugary foods that can cause dumping and include protein with your meals to help slow digestion. Fatty foods can also cause symptoms that are similar to dumping syndrome. For further information on dumping syndrome or treating low blood glucose levels can be discussed with your dietitian. Food intolerances. When starting new foods, you may find that certain foods can cause pain, discomfort, nausea, or reflux. The majority of times, this will improve by following the eating rules carefully and retrying the food again over the next few months. If you have tried the food several times over the first 6 to 12 months and it still causes issues, then remove this food from your diet. Food sticking. Food getting stuck can cause pain and increase the volume of saliva in your mouth. These issues can usually be resolved by following the eating rules such as taking small bites, chewing well, and pausing between each mouthful. Sitting at a table and stop eating before any fullness or discomfort is felt can also help. Weight regain. Without the ability and willingness to follow a healthy diet, the chance of weight regain is very high. Having bariatric surgery still means that you will have to work hard to manage food cravings, food choices, meal planning, and emotional eating. Stay alert to unhealthy or old habits returning. The sooner you recognise these, the better chance you will have of minimising any weight regain. Continue to monitor your weight, even if infrequently, to inform you of your progress. Get in touch with the team if you would like support in making some changes to your diet. This presentation has replaced the last group session you were due to attend. You should now understand much of the dietary recommendations for after bariatric surgery. If you have any questions or would like any further information about the topics discussed, then please ask your dietitian at your next appointment. The journey through our service has 10 steps. You are most likely to be at step 3 or 4. That means you will be having or will be due some support from the dietitians to help prepare you for bariatric surgery. Once you have completed these appointments with the dietitian and have been assessed by the psychology team, we hope that we can then refer you on to the surgical service. You must now confirm that you have watched this presentation so you can progress through the pathway. You can do this by emailing the dietitians at rch.bariatricdietitians@nhs.net. Alternatively, please leave us a telephone message on 01872 254569. Your message must include your full name and date of birth or hospital number. Without both your name and date of birth or hospital number, we will not be able to identify you to update your records. We look forward to hearing from you and thank you for listening.